So in order to understand, for those of you who have not had an opportunity to go through the process of being evaluated, okay, in a regular way to receive a regular hearing aid, okay, I want to take you, for those of you, I want to take you through what is the regular process, what is the standard hearing aid delivery system. So I made some here points that I'd like to kind of quickly go, with you. So what we do when we evaluate somebody, okay, for hearing, okay, we perform what is called pure tone audiometry, which basically is try to find out, okay, how much sound is needed for different sounds going from very low bass sound to a high treble sound. So if you look at the keyboard on the piano, okay, there are at least 8 different sounds, different pitches, okay, from starting from a very low tone to a very high tone, where we try to find out how much sound is needed for the person to be able to just detect presence of sound. We refer to this as pure tone audiometry. The other part, okay, which is on the B, okay, which is we try to find out, okay, now we know how well you hear. What happens if you increase, okay, the volume of the of speech, and we introduce different words to find out how well we can understand speech under improved loudness conditions. Okay, and that's an important part, because the fact that somebody doesn't hear and does not understand, it's obviously pretty clear, okay, pretty simple. However, there are people who have either relatively good hearing, or they do have a hearing deficit, but yet their ability to understand speech is very poor. Okay. So, let me just kind of say one thing regarding this. If you perceive that you're not hearing well, okay, and you have a mild, okay, to moderate degree of hearing impairment, that does not necessarily mean that you might have a hearing loss. It might also mean that your ability to understand words, okay, which is just beyond hearing, okay, it's not really adequate. Okay. So the other part that we do, going with the list, okay, with number C, we evaluate those people who are candidates for hearing devices. We evaluate them to find out what is their best listening level. Obviously, this is very, very important, okay? And we evaluate it for those sounds, which I referred before as the pure tone, as well as for speech. This becomes important because when we set up the hearing aids later, okay, at least, okay, in our practice, I use the most comfortable listening level as a kind of a starting point to set up the hearing aids at the best listening level, because this is where we really would like to function. Okay, now, when you go to the extreme, we want to make sure that we also find out what is the loudest discomfort level, which is the loudest sound that people would accept to tolerate the sound, to make sure that the device, the hearing device, is not going to exceed, if the sound in an environment is louder, that it's not going to exceed the loudness tolerance level, which can cause a lot of different issues related to the grading of hearing, and some other issues that I'm going to refer to. Okay, later. Now, then on the E is something that I've said, that I'm saying here, evaluation for dead zone. So when the hearing becomes at a certain level, okay, then trying to make the sound audible for this particular person, okay, for this particular sound, okay, might be not really advisable, because the sound will lose its tonality. Okay, when the sound loses its tonality, it produces distortion. Okay, so this is referred to, okay, as having dead zones. So we would evaluate somebody who comes in to see if, in fact, they have those dead zones, to make sure that we're not going to cause, additional distortion. Okay. Now, if needed, depending on the results of the test, we do some other tests, okay, and the abbreviation that you see here, the first abbreviation stands for Autoacoustic Emission, and this is basically to find out the function of the hair cells. The AVI stands for Auditory Brainstem Recording, okay, and this stands to try to rule out a possible benign growth on the auditory nerve. The ECOG stands to evaluate the function of the inner ear, the function of the cochlea, to make sure, okay, that that there was no issues related to the function of the hair cells. And VNG stands for a test which refers to balance and dizziness issues. Now, the last one, it's pretty simple, where we talk about the evaluation of the middle ear, okay, to make sure that there are no any presence middle ear disorders that should be treated medically. Okay, so all those things, okay, we look at. Now, this is a table right now that basically kind of shows you all the different degrees that we classify as normal, slight hearing loss, mild, moderate, and so forth. Okay, so in the category between mild to moderate, okay, we see that this is anywhere between 26 to 55 decibels. Okay. Now, for some of you, that probably doesn't really mean a lot, but my voice right now, and I'm assuming, okay, that you are keeping, okay, the level right now of the sound at the normal conversation level, it's somewhere between 45, okay, to maybe 50 decibel level. So normal conversational speech, okay, from 3 feet away is between 45, okay, to 50 decibel level. So the OTC hearing aids are recommended, okay, not beyond, okay, this level that you see here right now on the screen. Now, after this evaluation, initial evaluation, okay, we go into the explanation of the comprehensive audiological evaluation. We explain the result to the patient, and then we talk about different devices, okay, that based on the results of the evaluation, okay, would be appropriate. Now, we also take into considerations patient's lifestyle. Okay, what do they do? If somebody has a pretty mundane lifestyle, okay, there is certain types of hearing aid. If somebody is very active and still profession involved, then we want to consider some other hearing aids. What are the expectations? What is the physical dexterity? Okay, is there a need for some other accessories, connectivity with your cell phone? Okay, and obviously financial issues. After that, okay, there's an appointment that is scheduled for a hearing aid delivery, okay, which consists of adjusting, we refer to as programming the hearing aid, okay, and we take into considerations all the different evaluation that we obtain from the first testing. There is a certain process that we refer to as verification. So after the hearing aid is adjusted properly, we insert a little probe in the ear to measure the amount of sound that is generated by the hearing device, and we compare this to the hearing loss of the person. And we want to make sure that first and mostly that there is enough audibility, meaning that the sound across all the different pitches, okay, is distributed correctly, okay, to make sure that the person has enough audibility, which hopefully will result in good intelligibility, meaning a good clarity understanding of speech. So then we go into explanation and training for proper insertion of the hearing device, explanation and training for proper maintenance, pairing with connectivity with cell phones, okay, or other accessories, and explanation and training of the use of there are certain apps that sometimes go along with the hearing devices. So as you can see, okay, the purpose of this is just to make you understand that it's a process. Okay, it's not basically, here's a device, put it on, okay, and hopefully, let's keep our fingers crossed, and hopefully everything is going to be okay. Otherwise, we obviously wouldn't go through all of that. Okay. So after this, there are follow-up appointments. So the follow-up appointment is anywhere between 1 to 2 weeks post-delivery. This is just to make sure that everything is going well, there are no other questions, and depending whether the person is a first-time user or somebody who already has used hearing devices, okay, we do different types of additional programming with the hearing aid just to make sure that the amount of sound, okay, and the satisfaction of the patient, okay, is fulfilled. Okay. We go to some subsequent verification, again putting the same probe, okay, and then we repeat the steps, okay, from before, okay, until patient is satisfied, and obviously we are satisfied with the results of that. So the step number 6 is repeated as many times, okay, as is needed, okay, for as long as the patient still has some issues related to, what they hear and how they hear, or some questions related to the maintenance, the service, the connectivity. So we go through this as many times as is needed.